Last night, the World Health Organization came up with a detailed response to the letter written by 239 scientists who had asked the organization to declare transmission of coronavirus as airborne. The WHO last night has reviewed all the evidence that is available right now and has declared that the primary mode of transmission still remains through droplets from symptomatic people. It's a very important statement that the WHO has made, and also clarifies a lot of confusion about airborne transmission and droplet-led transmission. But for now, what we know according to the evidence available is that coronavirus or SARS-CoV-2 is still transmitted through droplets from symptomatic people. Of course, in certain cases or places, certain aerosol transmission cannot be ruled out, but those are also very specific settings, such as certain medical procedures where there might be a possibility of airborne transmission. But again, it's a very specific case setting. What is airborne transmission? To reiterate again, airborne transmission is defined as the spread of an infection agent caused by the dissemination of micro droplets, or also known as aerosols, that remain infectious when suspended in air over long distance and time. This is the definition of airborne transmission. Now, let's go at the evidence that the WHO looked at to come to this conclusion. WHO looked at several experimental studies, including the studies which the scientists had quoted, where it said that some of these studies found that they generated aerosols of infectious sample using high-powered jet nebulizers under controlled laboratory conditions. And they found the presence of coronavirus RNA in air samples within the aerosols for up to 3 hours in one study and up to 16 hours in another. But what the WHO says is that these findings were from experimentally induced aerosols, and they do not reflect normal human cough conditions. We don't know yet if a normal human being coughs and generates aerosol as much as the amount that was found through generating aerosols using high-powered jet nebulizers. And that's exactly why the WHO says that you cannot use this study to extrapolate that coronavirus is transmitted through airborne, because we still don't know, these experiments do not reflect the normal human cough conditions. They also looked at another study of healthcare workers who were exposed to the COVID-19 cases, but they were not in the presence of any aerosol generating practices. And here it's very important to note this, here they did not find any transmission when the contact and droplet precautions were taken by these healthcare workers. And these precautions were use of PPEs and masks. So WHO, looking at these evidences, says that these observations suggest that aerosol transmission did not occur in this context. To conclude this, to date, transmission of the SARS-CoV-2 virus by this type of airborne or aerosol route has not been demonstrated. However, of course, science is so vast that we still need more research because there is so much of implication about such route of transmission. But for now, the primary route of transmission continues to be droplet-led. And that is why we need to continue taking those precautions, such as hand washing, wearing masks, and practicing physical distancing.